Hi, my name is Dr. Jerome Walker. I'm a consultant medical microbiologist, a physician specializing in the diagnosis and treatment of infectious diseases. And today, I'm here to talk about the past, present, and future of polio in Jamaica. Polio has had a significant impact globally and locally, and it's important for us to reflect on where we've come from and where we're going in this fight against this disease. Polio is a highly infectious disease caused by the poliovirus, which primarily targets the nervous system. Historical records show that polio has been around for centuries, with evidence dating as far back as ancient Egypt, where hieroglyphs depicted people with limb deformities likely caused by this virus. This long history highlights the importance of understanding polio's impact on societies. Polio paralysis is caused by human enteroviruses, known as wild polioviruses. While the majority of infections are either mild or asymptomatic, the virus can sometimes invade the central nervous system, leading to paralysis in about 1% of cases. Additionally, there are instances where paralysis is caused by a variant strain of the virus, which I will discuss later. There are three types of wild poliovirus: type 1, 2, and 3. Immunity to one type does not provide immunity to the other types. Type 2 was fortunately declared eradicated in 2015, and Type 3 followed in 2019. However, Type 1 remains continuing to pose a threat to global public health. While the oral polio vaccine has been highly effective, it also presents a unique challenge. The live weakened virus in this vaccine can pass through the stool, which in areas with poor sanitation can lead to its spread. This can actually be beneficial and help protect communities with low vaccination coverage. But in some cases, the virus can mutate, leading to circulating vaccine-derived polioviruses, CVDPVs, which behave similarly to wild poliovirus. These, of course, are rare, but you are seeing increased rates around the world because of low immunization coverage. The global state of polio. Though rare, cases of CVDPVs have been increasing due to low vaccination rates. This highlights the importance of maintaining high levels of immunization globally. Currently, there are only two countries where wild poliovirus remains endemic: Afghanistan and Pakistan, highlighted in red in the map on the right, with 5 and 7 cases of wild poliovirus 1 respectively in 2024, totaling 14 cases. However, there have been 72 confirmed cases of CVDPVs around the world in 2024, 42% of which have been detected in Nigeria. And as you can see in the map, many countries in Africa and in the Pacific have cases of CVDPVs. And more recently, they have been found in environmental samples in Gaza, with 4 cases of acute flaccid paralysis and at least 1 confirmed case this year. So I'm going to talk a little bit about the history of polio in Jamaica. This timeline shows a brief overview of some of the major events of polio, and I will talk a little bit more of these in detail. So in 1957, this was the first time immunization with the Salk vaccine was given to children in less than 5 years. And at this time, you had over 80,000 children having received their first dose. And the effects were quite stark, with attack rates falling from 71 per 100,000 individuals of children less than 5, coming from 154 per 100,000 just 3 years prior. In the period between 1957 and 1960, there were very few or no children vaccinated. And you can see that the very young had high attack rates, with 72% of cases being in children less than 5 years old. In 1962, vaccination campaigns were going on and children were vaccinated with the 7 trivalent oral polio vaccine. And you can see that they were able to achieve good vaccination rates in children less than 5, having about 75% of children having received at least 1 dose. By 1964, you had outbreaks occurring in Kingston and St. Andrew. You had up to 60 cases in the country, with 56 out of 60 being in these areas, and 3 deaths. And again, most cases were seen in children less than 5 years old. Between the period of 1964 to 1969, there were 14 cases reported. And in 1972, there was an outbreak in Trinidad, and this had triggered a mass immunization campaign, and up to 50% of children less than 5 years old had received 1 dose of the vaccine. By 1977, the World Health Organization had expanded its program on immunization with a focus to immunize children by 1 year old. And Jamaica had entered this program between 1975 and 1979, and this had resulted in a phasing out of mass immunization schemes that had been done previously and moving towards an integrated routine immunization schedule. And by 1984, you had up to a quarter of children being vaccinated. By 1982, we had our final epidemic, and there were 60 paralytic cases reported and 3 deaths. Most of these cases were in St. James, mostly around Montego Bay. And they were able to, during this time, achieve 55% vaccination in children less than 5 years old, and up to 70% of children less than 14 years old were vaccinated. By 1994, polio had been declared eradicated in the Americas. It's important to note that our last epidemic in 1992 was quite costly, and in 1982 dollars, it had cost about 3.9 million Jamaican dollars. And by today's money, estimates could be anywhere from a quarter of a billion all the way to $1 billion. And costs are not only financial, You have lost man hours due to illness. You have loss of tourism and entertainment industries, cost of treatment and rehabilitation, and not to mention the cost of human suffering. I also want to take this moment to highlight Sir John Golding, who was a pivotal figure in the fight against polio in Jamaica. He was instrumental in controlling the outbreaks in the 1950s and later founded the Mona Rehabilitation Center for the Disabled. His efforts provided critical support for those affected by polio, and his legacy includes initiatives like the Polio Games, which helped rehabilitate patients through exercise. The global push to eradicate polio has involved a number of critical steps. The development of vaccines by Jonas Salk and Albert Sabin in the mid 20th century provided a way to prevent polio. The Salk vaccine is given via injection, while the Sabin vaccine, taken orally, offers broader immunity, making it easier to administrate these vaccines in mass vaccination campaigns. The Global Polio Eradication Initiative, GPEI, is a public-private partnership that has led the charge against polio. This initiative, spearheaded by organizations such as the World Health Organization, Rotary International, and the Bill and Melinda Gates Foundation, has reduced polio cases by 99.9% since its inception. The GPI strategy for 2022 to 2026 has two clear goals: to interrupt all poliovirus transmissions in endemic countries and to stop transmission of variant poliovirus and prevent outbreaks in non-endemic countries. Polio is a disease that can be eradicated because it only affects humans and no animal reservoir exists. Vaccines are effective, providing lifelong immunity, and the virus survives for only a short period in the wild. With constant surveillance and focused vaccination efforts, there is real hope that polio can be entirely eliminated. Derived polioviruses, vaccination is key. Communities with low immunization rates are most at risk, and outbreaks can be controlled through high quality vaccination campaigns, usually requiring 2 to 3 rounds of immunization. Rotary's Polio Plus initiative has been one of the most successful and enduring public health campaigns. Over the past 35 years, it has contributed more than $2.1 billion to the effort, protecting billions of children in over 122 countries. However, if efforts to eradicate polio were to stop today, more than 200,000 children could be paralyzed each year within a decade. As we've seen, the fight against polio has been long and challenging, but also one filled with tremendous progress. From the early epidemics that devastated communities to the modern global efforts that have nearly eradicated the disease, it's clear that we are at a critical juncture. With continued commitment to vaccination, education, and surveillance, we can finally close the chapter on polio, not only in Jamaica, but around the world. Thank you for your attention, and let's continue working together to ensure a polio free future for generations to come.